Good
This
stuff.
is the last question, then I'm going to open it up to all of you
For questions, yeah.
for questions. Coach, we've got a room of 5-star recruits here.
I don't know, Doug is a 4-star.
All right, we'll average them to 4.99.
Yeah.
So, what is your ask of these campaign athletes, if you will? What defines a great campaign? Excuse me, as a great campaign ambassador, as each of.
Okay, so I'm going to do something. I want you to bear with me, okay? So let's just act like this is our locker room, okay? And we're getting ready to play a game, all right? And so you're my team. Doug, you're walk-on, all right? No. But understand, every one of you can contribute, okay? And that's what's going to do it, okay? So we're getting ready to go out for a game. All right, you guys, look, we did not come here to play. We come here to win. Yeah. Duke wins. Duke doesn't play. Duke wins. When you go out on the court, I want you to give me your body, your mind, but give me your heart. You know what? Don't give it to me. Give it to one another. Give it to one another. And so when you leave this locker room in just a couple seconds, I want you to play with your heart and do it together. No matter how talented each one of you are, it's like the 5 guys that I'll put on the court. If they're really talented and go after you like this, it's not that good. And so what I want you to do is put your hearts, minds, and bodies together and go out like this. And we'll go like this. Now, on the count of 3, I'm going to say, Doug, listen. 1, 2, 3. And I want you to say, okay. And again, we're made for this, so we can do this. I want you to say together with heart, okay? All of you, put your fists out here, okay? Again, 1, 2, 3. Together with heart. All right, let's go, man.
Yeah.
Well, I'm just going to say we each had a father similar to Heather's grandmother. So our fathers each lived with Alzheimer's for 5 years, and it was very, very difficult for our entire family just to get everything in place for them. So we didn't even think long-term, short-term. It's like, what can we do? How can we help? It really wasn't until we met you all that we realized what you had just said. And when we've been involved for, I'm guessing 10 years, at that point they were looking for cures. Now the model has moved to shifting to prevention.
My grandmother is certainly part of my inspiration for doing this, but I think when I started studying the disease, the thing that I learned that really blew my mind is that, I became aware of my grandmother's changes when she was around 80. Repeating questions, getting confused if she was out of her environment, things like that. What I learned at some point during my medical and research training is that the changes in her brain that led there had started decades before. So we now have tools that allow us to understand that changes in metabolism, in the brain's immune environment, these changes are happening years to decades before we start seeing those memory problems. And for me, that is a huge opportunity. It's a huge untapped opportunity. So sometimes I joke that we run the largest Alzheimer's disease research study that doesn't enroll people with Alzheimer's disease. Because what we enroll is mostly people who are at risk of Alzheimer's disease. So they have a genetic risk or they have a family history. And the idea is we're enrolling them as young as age 25. and collecting data, samples, storing this, and making it available truly to the world. Because I also, as somebody who runs the Duke UNC Alzheimer's Disease Research Center, our motto is, when it comes to saving lives, we should all be on the same team. And so, one of the things that our center wants to do is to make these very rare and priceless samples available to the world. And so we store these, and these are an amazing group of participants who are so motivated to be in this study because most of them are caring for somebody who has Alzheimer's disease. So it's the adult children, in some cases grandchildren, of people with Alzheimer's disease, and they're contributing something that is rare and is where most of the field now realizes is our best chance to prevent and ultimately cure this disease.